We're now going to move into our next session, which is physical activity, breaking the norm to create the new. Now, participation in physical activity is evolving as we find new ways to move beyond traditional sports. The Commonwealth's new participation strategy and the Australian Sports Commission's upcoming strategy aim to boost activity levels, and this session will explore ways to advance physical activity approaches and knowledge. Our first speaker is Anthony Oakley, a distinguished Professor of Public Health and NHMRC Leadership Fellow at the University of Wollongong, where he is also co-director of the WHO Collaborating Centre for Children's Food, Nutrition and Physical Activity. His research focuses on movement behaviours in children, particularly in low and middle income countries. Anthony has consulted WHO, UNICEF and the World Bank on projects related to children's physical activity, and we are very fortunate to have him with us this morning. Ladies and gentlemen, please join me in welcoming distinguished Professor Anthony Oakley.
Thank you. Sorry about that. This is what I will cover today, and I promise that I won't say anything more about the State of Origin, but Karen, I'm happy to talk to you at morning tea if you want to know more about what that means. Now, the area of physical activity has certainly evolved in recent years, and whereas previously it was once thought that you had to play competitive sport or you had to do some type of physical activity that involved you elevating your heart rate continuously for a period of time and sweating and breathing heavy in order for it to be beneficial for health, we now know that that's not the case. And starting with this seminal study in 1953 by Jerry Morris, where he examined the incidence of heart attack or myocardial infarction, comparing those who were bus drivers with their more active counterparts who were the conductors, and found that there was significantly lower incidence of heart attacks among those who essentially were the same, except that they did a little bit more physical activity during their work hours than their peers. This study was replicated in another sample in the US, where again, those who were more sedentary on the waterfront were compared with their more active counterparts who were doing more manual tasks as stevedores, and it was found that those who were more active were significantly less likely to die from coronary heart disease or from stroke. Over the next 25 years, we saw an accumulation of evidence around the area of physical activity. And this led to the landmark Surgeon General's report in 1996, which summarised the evidence, and you can see some of it here, and it reported that the benefits of physical activity affect almost every body system. They are wide, they are varied, and not just for adults, but also for other populations such as children. And this certainly put physical activity on the roadmap and established it as a legitimate public health priority in many countries, including Australia. So we now know that physical activity is more than just sport, and it's more than exercise. They are subsets of a much broader behaviour, which is defined as any movement of your body muscles that raises your energy expenditure above what it is now. Although if some of you are fidgeting in your seats, it would still be classed as physical activity, but that's another story. And physical activity can involve movement that occurs in any domain. So it can be for those reasons that I mentioned before, but it can also be anything you do in your leisure time, how you might get to and from work, and what you might actually do at work can all be considered physical activity. It is measured on a continuum, going all the way through from sleep, which is not a form of physical activity and nor is sedentary behaviour, but they are being included and thought of now as we develop more contemporary guidelines, because there is more evidence to suggest that these behaviours are interrelated. They are in fact codependent on one another. So I might meet the physical activity guidelines and we know that will be good for my health. But I can undo some of those benefits if I don't get enough sleep because I've been staying up late engaging with electronic media. In Australia, our guidelines do take this 24-hour approach. And we have this for our guidelines for the early years and also for children and young people. And we are in the process now of establishing guidelines or updating the guidelines for adults, which again will be 24-hour guidelines. Our current guidelines for adults do, in a sense, mirror those that were reported in the most recent update from the WHO. So the important elements of this infographic are that we want to try and encourage all participants to limit the amount of time they spend sedentary, replacing some of that with any form of movement. So this idea that doing something is better than nothing, and if we can shift that population group who do very little, if nothing, then that's going to have considerable health benefits. But for adults, our guidelines currently are 150 to 300 minutes per week, and also on at least 2 days having activities that will strengthen muscle and bone. And WHO also provided for the first time specific guidelines for those living with chronic conditions or disabilities, which is very important. So we have a consensus group that met in April to be able to develop the draft and to get feedback from key stakeholders on our new 24-hour movement guidelines for adults and older adults. And these will be released early next year. So while I can't tell you too much about that at the moment, you will see on the left-hand side here the current Canadian 24-hour movement guidelines, which we have looked at adopting some of the elements of this in our own guidelines, but we have updated the evidence from both WHO and from Canada in the development of our new guidelines. So it will have some new features. And without being able to speak too much about these, we will have a guideline for sleep for adults, which will look very similar, if not identical, to that for Canada. And we will talk about the importance of light intensity activity and also have guidelines for those living with disability and living with chronic conditions. And for the first time, we will speak about the importance of functional mobility, not just for older adults, but for adults as well. So thinking about how we might prevent falls in an older age and improve balance right from the age of 18 and onwards. And one of the other features that was very clear from the feedback we had from stakeholders was that while it's important to have a time guideline, sometimes people find that difficult to operationalise. And many people now are using devices that allows them to track their steps. So would it be beneficial, or could we also consider having a statement about how many steps per day? So a colleague, Melody Ding from the University of Sydney, has been updating the evidence and has done a thorough systematic review and meta-analysis of a range of health outcomes. Here you see presented the number of steps per day on the x-axis and the hazard ratios on the y-axis. And you can see here for CVD mortality, all-cause mortality, and type 2 diabetes, that there is a clear dose-response relationship, and that the sweet spot or the inflection point seems to be somewhere around 7,000 steps per day. So that is probably where we will land with the new guidelines. So look out for that. It is somewhat different to what we might think, how many steps you might need to be able to reach health benefits. But the important thing here is you can see that the health benefits kick in even from as little as 1,000 steps a day. So some movement is better than nothing. As was alluded to before, what data do you have in Queensland? You've got some very good data on physical activity participation. And you can see here that for adults, there was an increase over the first decade during the 2000s. This has plateaued off somewhat in more recent years, but nonetheless, there has been an increase over time, which I think is a positive sign. The same with children and adolescents, albeit a little bit slower, but it is still trending in the right direction for the data that you have over the past 10 years. However, there are still some inequities that are present. So we still see differences across all ages between men and women, with men being more active. This gap does look like it's closing a little, but there is still much work to do. And there is also a considerable proportion of the population, particularly in those middle age groups, who are doing less activity than those who are younger or those who are older. So they clearly need to be a target group for promoting physical activity. From an equity perspective, if we think about social disadvantage and remoteness, you can see here for children that it is slightly different to what we would see in other jurisdictions. And that is that the most disadvantaged children in your state appear to have higher levels of physical activity than those who are most advantaged. And those who are living in more rural and remote districts, again, also tend to be more active. This flips around when you get to adulthood in Queensland, where we do see trends that are consistent with other states in that the more advantaged you are, the more active you are, and the same with those who live in urban areas. So clearly some work to do here among adults among these groups. And what is disturbing perhaps, and is mirrored in other states, is that this gap between the most and least disadvantaged appears to be getting bigger over time in Queensland in terms of physical activity participation. So lots of good work happening, but clearly still more work to do. And your Activate Queensland document identified a range of barriers that individuals said were prohibiting them from participating in physical activity. These are mostly at an individual level and are related. So clearly, if you're working too much, that's going to have an impact on the amount of time you have available. Cost is still a considerable barrier, and particularly for children, competing demands of electronic screen devices on their leisure time makes it more difficult to provide opportunities and for physical activity to have a place within their daily schedules. Again, individual factors around levels of motivation, fitness, ability, and feeling included are important in terms of promoting physical activity. But what we need to think about too is broader than this, and think from a social ecological perspective about the environments, about the family setups, and also about the policies that are in place to be able to make it easier at an individual level to be active. So that's something that I think can be particularly addressed and where we need more data to be able to speak into. So participation has evolved over recent years. And what we're seeing now is that individuals, as a result of COVID, are undertaking more home-based activities, whether that be using the space that they have or tapping into virtual sources online where they can be active. But they also want to participate in their local neighbourhood in outdoor activities, so ensuring that these are available and providing participation options there. People are looking for more holistic approaches where they can integrate physical activity with mental health, and certain activities such as yoga, Pilates and Tai Chi are becoming more popular as they take on that approach. There has also been much done to make physical activity opportunities more inclusive and more accessible to those living with a disability and to those who are financially less well off. And we have seen an increase in outdoor and adventure type activities. And your state is very well set up to be able to promote those types of activities, having such a wonderful physical and outdoor environment. So we're seeing activities such as hiking and surfing, trail running, becoming more and more popular. So they are what we would consider non-traditional activities. And also when you think about activities such as dance, recreational leagues, so things such as pickleball and frisbee, park run, those types of activities are certainly flourishing in environments which are set up and well suited for those. The Australian Sports Commission put out a strategy around how it can promote sport among all Australians. And what I think is important to note from this document is the reasons why people play sport. So it's not just for health benefits. You can see here that the benefits are also wide-ranging and take on board social factors, wanting to give back to the community, and wanting to be involved with their family in activities. So providing an environment that supports that is very important. And what the Sports Commission did that was quite foresightful was that they not only interviewed the people who were participating in sport to find out what the barriers were from them, but they interviewed the volunteers and the workers, because without those people, much community-based sport would not occur. So overcoming the barriers for these people was also very important in terms of the strategy. And we see a strategy now that has a strong focus on diversity, inclusion and equity, and about picking up on aspects that wouldn't normally be part of a sports participation strategy. And in particular, thinking about sport as a lifelong investment, and that at certain points in people's lives, they may tap in and tap out of sport. So how do we provide pathways for them to enter and then re-enter again? How do we build capacity within these organisations so that we have plenty of volunteers and workers to be able to provide the environments that we're trying to foster? Whether that be through providing resources, training and education for them, ensuring that the workforce is representative of the people who are participating in the sport. The importance of having spaces and environments that also are inclusive, that also are welcoming, and that are accessible to all. And then transforming the culture. We hear lots about ugly parent syndrome around sporting fields and about some of the negative aspects. How do we change that, and how do we make it the norm that sport is, in fact, a fun environment where all people are welcome and it is inclusive? So this strategy does take a new approach. It's a much needed approach, and the focus here, I think, has been replicated, certainly from what I've seen here in Queensland, around the focus on those aspects. And the other thing too is the increase in technology and people using technology now to be able to monitor, to be able to engage with others in a community, and to be able to support their physical activity. You might not be aware, but this month is September, which is raising funds for those with cerebral palsy, and there is an app obviously to support that. But these types of initiatives here are again things within the community where people are using physical activity as a way of promoting a particular cause. Other community-based activities which you are doing here in Queensland very successfully are Parkrun, and there's a photo here from Atherton up on the far north coast. There is a Heart Foundation walking group here in Logan, and these are replicated across other parts of Queensland. Apps such as Strava allow people to not only map what they're doing, but to share that and to be part of a community where they can encourage one another around being physically active. But also there is this campaign here, which is from Western Australia, which takes a focus again about the social aspect of physical activity and trying to tap into the social benefits of allowing people to connect more with others as a way of promoting activity. Your Activate Queensland strategy is really groundbreaking. I like the way that it mirrors the Global Action Plan for Physical Activity in terms of focusing on the people, the environments, the policies and collaborations between those. It has a strong focus on equity, diversion and inclusion, and about transforming the attitudes and behaviours around physical activity, and about the importance of how we share that knowledge among stakeholders. And there are again some wonderful community-based examples here of initiatives that are successful in Queensland and that are serving their communities, promoting those very key aspects and values that we talked about and that have been sustainable over a period of time. So Activate Queensland talks about the Challenge the Mountain event in Rockhampton. I am Inspiring and Active Mackay, about programs for those with disability, and of course the 10,000 Steps program, which is well known in Rockhampton. I would like to bring your attention to maybe a couple of other areas that you might like to consider as part of your strategy for promoting physical activity. It's always good to come back to what the evidence says works. And thankfully, WHO, the International Society for Physical Activity and Health, has identified what the evidence said are the best investments for promoting physical activity. And the two of those that I want to focus on are whole of school programs and the mass media, where we do have good quality evidence. And in addition to the Global Action Plan for Physical Activity, WHO now have a series of toolkits for different sectors which provide specific guidance about how to promote physical activity and how that fits into a systems approach. So this one here talks about whole of school programs, and one of those that is from Australia, it's actually from the University of Newcastle, is called Physical Activity for Everyone. So it takes a whole school approach, focusing on all of those aspects in the preceding slide. It was first tested in an effectiveness trial, and it was found that at an individual level, adolescents who were in the intervention group participated in significantly more minutes of MVPA per day than those in the control group. So once that had been established, the program was then scaled up and tested again, and tested this time at a school level to be able to investigate how many of the practices which had been shown to be effective and efficacious actually were taken up and implemented at the school level. And you can see here that over a period of 12 months, those in the intervention schools participated or took up, implemented significantly more of the practices, and that they were able to sustain these after 2 years. So again, embedding these into the school culture and into the day-to-day routines is very important. There are other programs in Australia, Transform Us from Deakin University in Victoria, iPlay from the Australian Catholic University. We have many good examples of these school-based programs in Australia to consider. And the other are communication campaigns. And these have been popular in various countries. There have been some that have focused on specific populations, like adolescent females in the UK. One from Western Australia, which was about swapping more sedentary and electronic-based leisure activities with more active ones. And the one here which has perhaps the most evidence is called Verb. So it is from the CDC in America, and it has been rigorously tested. And it has been found that the more frequently children were exposed to these messages, first of all, that was resulted in a higher number of free time physical activity sessions. So they were more likely to participate in a greater number of sessions of physical activity. And the other figure on the right shows that even as little as once per week being exposed to the messages resulted in a significantly higher proportion who were active on the day before. So these campaigns do work, but they need to be supported obviously by environments that make it easy for these children to be active, and supportive parents as well. And this promotional campaign from Western Australia, as I said before, is very unique. It's called Live Lighter. It's a physical activity promotion campaign, but you don't see the word health mentioned anywhere. You don't see the word exercise. You don't see the word physical activity. It's all about types of things that people will find very easy to do. So it's very easy to move more. And by moving more, it's going to have these benefits. Again, not a focus on health, but a focus on feeling strong, a focus on feeling happy, tapping into emotional health, and a focus on social connection. So these things appear to be very salient with particular populations in terms of messaging that does have an effect above and beyond what we would traditionally think is important. And We also need to focus particularly on that group in the population who are doing very little. So as I mentioned before, there is a significant proportion who do no physical activity. How do we get them to do something? And that something can be as little as standing more. And you can see here that from the National Health Survey completed in 2022, that as you get older in Australia, you spend more time sitting, you spend less time standing, and you spend less time doing lower intensity activity such as walking. So how can we shift that? How can we try to replace some of that sitting with more standing? Well, one of the things that we can do is think about environments that foster sit to stand transitions, whether that be through workstations, whether that be through taking breaks as part of your workday, and again, having guidelines that reinforce this. So guidelines that talk about replacing sedentary activity with any physical activity can be beneficial for your health. Don't worry if you can't get to the 150 minutes of moderate intensity. Just start doing something if you're doing nothing. And even something as little as standing more as a transition from being more sedentary to being more active will be beneficial for your health. So I'm expecting a standing ovation at the end of this from everybody. It was mentioned before about your fair play vouchers, and again, what I think you've done in this state that we should have done in New South Wales is make them more accessible to those from low-income families. So as you can see, the data that we've collected here, so these started as 2 lots of 100 vouchers for families, which would offset some of the costs of participating not just in sports, but it could be used for dance, gymnastics as well. These were reduced to $50 last year, but there was some evidence that was collected and it was very positive. So it increased participation across all social demographic groups, but unfortunately most of that increase was in the higher income groups. It did contribute to nearly half of the total time that children spent in structured activities after school hours. So it did meet a gap in participation in those types of activities, and it was shown from parent-reported data that these children did see benefits to their health and to their concentration as a result of the increase in physical activity. So nothing but good news there, and it's great to see that you are implementing that successfully in Queensland. As was mentioned, you have a wonderful opportunity here with the Olympics and Paralympics coming up in 8 years' time. An opportunity right from now to think about how you can use this event to be able to promote greater participation in physical activity across the population, whether that be in the planning that occurs now and the different sectors that come on board and work together, the different venues that you have, and thinking about how these can be used by the public, both in the lead up to and after the Olympic Games, so there's a sustainability aspect here too. And we have seen that a lot in Sydney, that a lot of these venues are being used by the public. The infrastructure that's being built, the legacy, and I'm delighted that Health and Wellbeing Queensland will be the legacy partners on the health legacy of the Olympic Games, and they're already in talks with WHO around that and how that is being done by them for major sporting events. Ensuring that the infrastructure, the facilities are accessible and available to all of the population, and educating the public now about the importance of participation in physical activity well ahead of the Olympics so that they can see how the changes that are being made can be beneficial to them as well. And I do have to also talk about the importance of not having competing messages here. So if we're talking about this from a health perspective and promoting physical activity, we need to make sure that we're not having conflicting messages from sponsors that are not associated with positive health. You are already using systems approaches here in Queensland through your Activate Queensland strategy, and again, that is a wonderful thing. The important thing with these systems maps is not just the actual areas that you identify, but integrating those and the lines between the different strategies. So you can see here that if we were going to improve access to public open spaces, we would need to ensure that there is dialogue with those who are responsible for road safety in the Ministry of Transport, those that are responsible for providing the workforce that will provide that access. There needs to be social marketing campaigns that support that, and there needs to be some research and evaluation around it to ensure that it is being properly evaluated. So in conclusion, I would want to encourage you to continue to think creatively about how physical activity can be integrated into daily life, to continue to have strong partnerships and to collaborate with one another to promote and increase physical activity statewide, particularly focusing on those groups where there is a need, to ensure that all physical activity opportunities, spaces, policies and programs can be inclusive of all members and that all of them feel supported to be physically active, and that having these strategies in the lead up to the Olympic Games does really provide a unique opportunity. So Queensland can become not just the sunshine state, but the active state. Thank you.
Thank you. That's Distinguished Professor Anthony Oakley, and a wonderful presentation that we will now explore in a bit more depth. I'd like to invite Tiani Van Haren, Executive Director, Partnerships, Strategy and Development within Sport and Recreation at the Queensland Department of Tourism and Sport, to join us. Tiani has extensive experience in the public sector, in particular within the sport and recreation portfolio, where she currently leads the Partnerships, Strategy and Development team to drive collaboration and create the direction for the Queensland Government and active industry, encouraging Queenslanders to chase that healthy lifestyle. Could I also welcome Associate Professor Sian Gomersall, Associate Director and Principal Research Fellow at the Health and Wellbeing Centre for Research Innovation at the School of Human Movement and Nutrition Services, and a teaching and research academic in physiotherapy at the School of Health and Rehabilitation Sciences at the University of Queensland. What a title is that! Associate Professor Gomersall is an expert in physical activity, sedentary behaviour and health. Her research is focused on understanding, measuring and influencing physical activity and sedentary behaviour, the prevention and management of chronic disease and physical activity promotion in healthcare settings. Thank you. And last but not least, Tim Clark, the Chief Executive of Q Sport, the state's peak body for sport, and his career includes senior roles with state and national sporting organisations, the Queensland Academy of Sport and the Connecticut Group. In his current role, Tim works with stakeholders to unlock enduring impacts through improving learning, investment and collaboration. Tim is also a member of the leadership group for Play Well, the nation's first 10-year sport participation strategy. Could you please give them a warm welcome? Okay, Anthony, before we get underway, just in headline terms, is it that the guideline is 300 minutes of movement per week, generally?
No. For adults, the guideline at the moment is 150 minutes of moderate intensity activity. So accumulate that much over a week. So moderate intensity, think about that as equivalent to a brisk walk. If you want to do more intense activity, which we would call vigorous, which is like running, then it's only half of that.
So just in broad terms, what proportion of the Australian population would meet those guidelines?
Oh, that's a good question. It varies, of course, by different demographic groups.
But just generally?
Yeah, it's about 40%.
40%, so 60% don't. Tim, beautiful country, we love our sport. Why is that figure so low?
I think there's a range of issues, Madonna. I think Tony's outlined in a couple of those network maps there particularly that there's a range of things that have to come together for this to work, not just at an individual level, but across the system. There is heaps of opportunity, but it's not necessarily available to or equitably available to everybody. I think the other thing we've got a habit of doing from a sport perspective is saying, we're going to build it and you should come. And I think the argument here is that actually pulling on a pair of shoes and grabbing the dog and walking out the door in the morning is legitimate. And actually, if that's your way into being physically active, how does sport meet you where you are? And I suppose enable and encourage and support that activity. Could you do that when you bring your children to play sport, rather than us saying no dogs, which I think is also what happens.
Great answer, thank you. Tiani, can I go to you, because we keep hearing the word Olympic Games, the Cho talking about Paris, and it's becoming a theme. But the headlines I'm reading are about the venues, costs, transport, even the number of medals we might win. What's the opportunity, do you think, for a general embrace of physical activity? And is there an area where you think it's more likely to occur?
I think that's a great question. And I think that, like Tim, I am really optimistic about the opportunity. Where I think Tony showed the Elevate strategy on the screen before. That really focuses on looking at the first 10 years as well as the 10 years after. And I think I probably need to pay you for the amount of times you said Activate Queensland, but Activate sets us up really well for delivering on Olympic legacy. So we're in a position where no one else has been. We've already galvanised an industry, and we refer to the active industry because it's not just sport. It's all of our organisations that help people get active. But we've already got that galvanisation occurring. So it's about translation. And so that equity piece is really important.
And I'm going to come to equity further in just a moment, but Sian, I could see you nodding during Tiani's answer, and I'm wondering how you think we might capitalise on increased attention for the Games for those populations who might be sitting outside the southeast corner of the state, or who might be more challenging to reach, perhaps.
I think that's a really important thing that we need to be able to focus on and have front of mind when we are thinking about legacy. And, I think almost all of the comments have already touched on equity and reaching those who need it most, and being able to think outside of, transport corridors from the athlete accommodation through to, that's all inner city Brisbane, and being able to actually reach those populations. So thinking about where we can host those different sports and different events, and being able to build communities around those that promote physical activity, I think will be a huge opportunity and a challenge as well, but one I'm sure we're ready to tackle.
Tim, you're nodding. The intractable headwinds that we're seeing, that we will see in equity opportunities, how do we go about fixing that while we have time?
It's fundamentally about collaboration. I want to go back to Tony's final slide there, innovation, collaboration and inclusion, right? As primary drivers of change, that more of the same is not going to get us there. That actually there has to be a step change in thinking to drive better co-design, to drive better policy, to drive better investment, to drive better activation, that kind of chain. Because I think the short answer to your question, Madonna, is that there's an inertia that goes with how we've always done things. And
in sport or more generally?
Generally, right? And I mean that both in sport, because sport is comprised of all of us, and the way that we live our lives, we're running hard all the time, we're busy, right? And so trying to ask people to compartmentalise the pressure they feel to get everything done in their normal lives, to then come to sport to slow down and be more inclusive and more equitable in the way we think about opportunity. We're just trying to keep the lights on, right? I'm trying to keep food on the table and the roof over the head. So sport, I think, has to realise that it's playing a bigger game. It is not just about Tuesday, Thursdays and Saturday mornings. It is a contributor to something much bigger than that, but it also needs to be sympathetic to or empathetic to the fact that the people who walk in the door to turn the lights on and deliver the game have got other things in their lives, and sport needs to make it dead easy to be the deliverer.
Tiani, agree?
Yeah, I don't think I can actually add anything to
said
what
it pretty
Tim
well,
said.
didn't he?
Like, that was absolutely on point. I think the active industry is really primarily volunteers, and so it's about thinking about those volunteers and the service they provide to Queenslanders, and how can sport help those volunteers make that as easy as possible for them.
Yeah. I'm just the warm-up person. I'm going to go to questions from the audience before the end of our session. So if you've got one relating to your program or a question about the presentation, I would love to go to you soon and hear what you would like to ask. Anthony, your research focuses on movement behaviours in children, and particularly low and middle income countries. Can I ask what keeps you awake at night in terms of physical activity and children? And is there somewhere else in the world that is doing this better than us?
I think that my biggest concern at the moment is I see so many middle income countries that are transitioning, and I see that they're not paying attention to physical activity. So urbanisation is resulting in many families moving to cities, and the accommodation in that where they live provides very little opportunity for them to be physically active. The environments around them are not conducive at all. There's pollution, there's very little green space, there's lots of motorised transportation, which makes it difficult to actively commute. So that keeps me awake at night. Countries that I see that are doing well, there's a number of countries in South America that are actually bucking the trend around this and are saying we need to make sure that as we are planning our cities, we are paying attention to the things that I just mentioned, that we are ensuring that, so some of them close off streets for a day a week so that it allows families to go and use that for a range of physical activities because there's no other space for them.
That's a great example. What other examples are some people doing?
Oh, look, I think the other ones, there's a lot of good school-based programs that are occurring in different countries, again, that are involved with training up teachers, which are involved with ensuring that physical activity is an important part of the curriculum and that it's promoted, that are opening up their facilities after school hours for the public to be able to use. And there are some great ones. One of the ones I love is in Zambia, in sub-Saharan Africa, where they were finding that girls were actually adolescent girls were not participating, not attending school because they found the walk was too difficult for them, and it was too long and it was unsafe. So they provided them with bicycles, and so this actually resulted in them not just being active, but in attendance rates improving in that as well. So they're now trying to get bicycles to every girls that is able to use that to get to and from school.
That raises a great issue, and maybe I'll go to Sian first with this question. But you know, educators express concern that girls, particularly around adolescence, might decide to stop swimming or to stop ballet, anything where they have to show their figure, I guess, or they don't make the A netball team or the A volleyball team, so they choose not to participate. That message to teen girls, you know, messaging is so important. What can you talk to us about there?
How did you know I was an aspiring ballerina?
You look like it.
You've hit me right where it hurts. I think breaking the norm is a great theme to respond to that, because I think creating inclusive spaces, creating, you know, places where there aren't expectations around what to wear, how to behave, how to move, and being able to create those environments and the human aspects of those environments as well. That requires cultural change around what people would be expected to wear and do and act in those environments. But I do think that creating an inclusive space where people feel safe and not judged is very important to promote that.
Would anyone else like to offer something there, Tiana?
Maybe just a little thing, because I'm a mother of a teenage daughter who literally this year decided to stop playing sport. She has joined a gym, we compromised, but her thing wasn't about any of that. It was about her friend group. So the girls that were playing for fun weren't continuing on because it became very competitive, but she still loved, and I loved watching her play, and I was like, I almost wanted to get graphs up. I'm like, Layla, you're like genuinely a statistic.
Because, I mean, I think Sian and Tiana raise a really interesting point here, Tim, because, you know, when we talk about the Olympics, we're talking about medals and not participation, people who are the best. But what we should be aiming at for just raising that participation level, which is a harder thing, isn't it?
Oh, no question. I think the only thing I'd add to that as a segue into what you're asking about, Madonna, is that 14 to 16-year-old girls are not a homogenous group, right? There are segments within that cohort that need to be understood and engaged in conversation to understand how it is they'd like to be engaged. Yeah. And I think having spent some time working for netball as the preeminent sport of choice for lots of women and girls across this country, one of the things I would say after 6 years inside those four walls is that it is an extraordinary opportunity to do a much better job of engaging women and girls in sport. And to some extent that's happening, and here's the pivot, right, is that something like the FIFA Women's World Cup and the FIBA Women's Basketball the year before, what we're seeing in terms of women as a contributor to medal counts in this country right now across Olympic and Paralympics, that should act as a convening force for a conversation about how we're actually going to convert moments of inspiration into real people making decisions to walk out the door with their shoes on.
Whose job is it to convert those moments of inspiration?
Yeah, it's an easy answer, but I come back to the system again, right? I think it's the challenge that sport has, talking about my own backyard, is that we're quite sort of siloed in our thinking naturally, and I think by accident sometimes rather than by design, we suddenly go, oh, Department of Education, we should have a conversation about how these kids that we're trying to get involved after 3:30 are with you for the 6 hours before that. And my really strong view is that actually it would be through collaboration across traditional boundaries like a school gate that we could revolutionise the way in which physical activity is created by way of opportunity.
There's so many people in this room who put their heart and soul, as you do, into policies and programs. But is it to the young person, or is it better off there's a piece here to their parents and parent education?
No question. I mean, I'm a parent of a 6 and a 3-year-old, and I have an extraordinarily rose-coloured view of the formative power of sport. It's a positive force in who I am today, the way I parent, the way I show up to work, all of those things. So I'm naturally inclined to want to include my children in the same experience that I had. But I have really good friends who had an awful experience of sport. And so how we engage parents, I think, in conversation needs to start by recognising that it's usually someone like me who had a great experience who turns up and says, you should get your kids in sport. The parent says, no way. And actually, we need to have a conversation with the parent to understand, what was your experience like? Let's unpack that, and then let's kind of demonstrate in a way that understands parents' motivations of wanting the best for their kids, how what they had won't be the same for their own.
Anthony, what are you thinking hearing that?
I think it's not an either or, I think it's both, and depending on the age of the child, they will have more agency over the decision made around participation. But certainly it's important for parents from a young age to be able to introduce them to sport, as Tim said, to be able to transport them to sport as well, and to be able to pay the fees that are there. But in addition to that, parents are great role models, the dominant role models. So it's and when you ask children about those experiences, it's not that the parent was active themselves or was a great athlete or participated in the sport. It was how they supported them to be able to do that the children see as the role modelling that occurs there. So that's in a sport perspective, but then there's also other forms of activity within the community, within the local environment, where again I think parents have a really important role to play. And I think that are the key drivers for those children.
You, among your fascinating graphs, had one that showed where children are more likely to participate, rural or city, socioeconomic group, etc. Can you just add to that in terms of age or gender? Is there a specific cohort that you think this really worries me? Or that is really easy to influence on the flip side of that?
Yeah, I think there are certainly key transition points in the lifespan. So that transition from primary school to high school, and in adolescence, we know that there's a precipitous decline in activity for a whole range of reasons. But that's one of the key points. The other one is moving from high school or the end of high school into either work, trade, further study. That's another key point where activity levels tend to decline. So again, I think being able to address those transition points where we do see the large declines is perhaps where it's needed most.
I loved how you talked about, the changing types of things we do in terms of physical movement, from yoga to whatever. Can I put you all on the spot and you tell us what your physical activity is? What do you do to keep moving? Tim?
I'd chase a 6 and a 3-year-old around.
All right, you win.
And a dog, I should say, the other thing. I mean, and I think that's the resonant example in my head is that...
So it's incidental exercise, you're saying?
It is, and I think it's a sample of one, right? But I think I'm in the situation where I'm waiting for something to spark or catalyse me. As I said, spent a lot of time in sport as a participant, as a coach, as an official previously, and now I'm at a chapter in my life where I'm thinking, I just want to get back to it, but God, that feels so incredibly difficult, right? And yet I'm inside the bubble of the situation that could do something about it, right?
Yes, absolutely. I'm sorry, but there's an irony there, isn't it? We're
Absolutely.
here saying how important it is.
I know. You did. Yeah, I've been super vulnerable with you there, Madonna.
I feel special. Yeah, okay. I mean, and thank you for the honesty of that answer, because I think that's what a lot of people are actually feeling, right? Sian?
Well, my favourite thing to do is a rhythm cycle class, which brings together some of what Tony was talking about. So it's dancing on a bike, basically, on a stationary bike that goes nowhere. It's my guilty pleasure that I've now shared with all of you. And it's the only time I leave my phone outside of the room that I'm in, and about 40 minutes in, after you've been working very hard for 40 minutes, they stop yelling at you and put on one track that they just let you move. And that's probably one of the most favourite moments in my day, and it's combining the vigorous intensity activity along with one of the only places that I can really stop. Fantastic.
Learnt something today, or more than one thing. Yeah, Tiani?
Oh, it feels so boring now, Sian. But I am on day 4 of September, so and I am an avid park walker, not a park runner, but I love doing park walk. I love doing it with some girlfriends. They often talk about the fact that I get like an endorphin 3K endorphin hit, and they're like, God, Tiani at 3Ks is so painful to walk with. I love everything all of a sudden.
Yeah, I love the answer, both with what you said to your daughter and that. So, Anthony, just before we hear about your fitness regime, there is an endorphin thing that kicks in. I thought it was with huff and puff, not with actually walking.
Oh, look, I'm not a biological scientist here, but I think any type of activity can provide those sorts of benefits to your mental health.
So what's your activity?
Well, look, I sympathise with him because I was in that position once and it was very difficult. Fortunately, my kids are all adults now, and I'm part of that group in the late 50s where you see the increase in physical activity. Yeah. So enjoying that extra time. Look, I have 2 staffies, and if I even go anywhere near their leads, they are up and at the door. So they actually help keep me active along with some other things. I really do want to emphasise the importance of some type of muscle strength activity as you get older, and functional activities to maintain your balance and prevent falls. They've been really important for me.
What about the importance of huff and puff as opposed to incidental, a walk to the shop?
Yeah, look, they're all good, okay? And for those people that don't mind the huff and puff, you don't have to do as much of it. Yeah. And certainly more of that intense activity can be beneficial to your health. It certainly has been shown that the dose response there. So the more intense the activity, the greater the health benefit. However, the biggest bang for your buck you get is if you go from doing nothing to doing something. So even just doing something is going to significantly provide greater health benefits. Then once you've established yourself in that something category, then you can move on to doing something more.
Yes, I'm just going to continue going down this track for a little moment. Sian, is it best to do a 60-minute run or 6 10-minute runs, do you think?
I'll take either of them.
Okay.
For someone else doing it. I I always, I teach first year physio students, and I always say, if you see me running, run with me, because I'm running away from something. So either of those will benefit you, absolutely. And in fact, if you walk those 10 minutes, that will also benefit you. And I think we need to be really consistent with that message. I think promoting or over-promoting the high intensity or higher intensity is is exclusive as well.
I wonder also, you talked about dancing on a bike, and Anthony talked about, the increasing movement towards yoga or Pilates, perhaps. The topic of our conversation is those new ways of doing things. 2 years ago, we were carrying tyres around the park as exercise. Pilates classes have now just skyrocketed. Is there anything on the horizon, a new type of activity that is starting to get carriage elsewhere?
Oh, I don't play it, but pickleball is everywhere, which Tony mentioned.
That's Ted Lasso's involvement, isn't it?
I'm not sure who that is, but I'm at the cycle studio. I think what's been really great to see over the passage of time is that, sure, there are trends and they do move with time, but that increases participation. New ways of moving also bring new people to movement. Physical Pilates may appear to be low intensity, but it is one way of achieving really important strength guidelines. Yes. And if we look at the proportion of people meeting aerobic physical activity guidelines, which is the 150 minutes that we mentioned first, those proportions are much higher than if you include the proportion that meet both the aerobic and the strengthening guidelines. And so the strength guidelines are kind of sometimes described as the forgotten guideline, and so these new ways of moving, I'm hoping will address some of that as well.
Yeah, great answer. And Tiana, you wanted to add something.
Yeah, I did. I just wanted to add that, there's 5.5 million Queenslanders, which means there's 5.5 million ways people want to move. Yeah. So we really encourage a breadth of activity, and I can't remember off the top of my head, we do have it somewhere on our website, but I think it's around about 162 different activities are funded through sport and recreation currently. So that's, circus skills. It's probably not yoga with goats or anything like that. But if there's a thing that's your thing, it's somewhere. It's just about how do we make sure that that's everywhere, not just Southeast Queensland.
I should just actually qualify, there is something called yoga with goats, and it is a big specialty of the Ekka in Brisbane every year, isn't it?
I've done it. I didn't do much yoga. I was distracted by the goats.
Anthony, anything on the horizon that you're aware of?
Oh, look, I think what's becoming more popular now is cold water swimming. I don't know if you can do that in Queensland, but just for the benefits that it provides as well. Yeah, so that might be something for you to consider.
Okay, and a last question on this before I move on to more intellectual pursuits. Although this is important, isn't it? But you talked about sleep too, and I'm thinking about what you said, Tim, when you said, come home and you've got dinner and you've got children, so it's where we prioritise sport. It's 8 o'clock at night. Would an hour of extra sleep or an hour of extra activity, Anthony, be better? Well, at least I didn't say, or an hour of a glass of wine.
Well, the evidence would say it may depend on the health outcome that you're interested in. Yeah. I think they're both important, so I don't want to play one off against the other. Doing that exercise close to your sleep may impact on your sleep, depending on how intense it is. But when we talk about the integration of guidelines, we do talk about the importance of getting that physical activity piece first. Yes. And then with sleep, there's a range of times. It's not like it's a certain threshold like we see for activity. So there can be an upper or a lower range with that. So I would say do both, but try to factor in that exercise, perhaps not too close to your bedtime.
Is there any evidence or research showing you get more bang for your buck by exercising incidental or high impact early in the day or late in the day or a particular time of the day?
No, I think any time of the day is good. I mean, there's some evidence. It's quite conflicting in terms of, you know, when you exercise and then when you eat, purely from a healthy weight management perspective around that. But no, I think do it. Some people love to do it in the morning. I'm one of those people.
Yep.
Others prefer to do it of the night afterwards. Any time I think is important as long as you do it.
If the Chief Health Officer was up here, he would be saying, and wear a hat at all times. Sian, you wanted to add to that?
We have conducted trials to have a look at this because it is something that we see in the media a lot around morning versus evening exercise. Echo Tony's comment, the time you will do it is the most important time. But to be able to be flexible with that and to have flex in the way that you might approach your day, that if you miss your opportunity in the morning, that's, you know, you haven't missed the only time that you can do it. And so to have some adaptability and flexibility over.
Thank you. Look, if we look at this panel, there is an extraordinary depth of talent and research in what you do. But how do we all work together more, particularly, I guess, governments and universities, to build opportunities? Who wants to go there? Tiana, you looked at me first.
Only because I think Sian and Tim will both steal my answer. Because I think the answer is collective impact. And Tim and I have had many conversations about how do we do this translation piece? How do we get what's in researchers and academics' heads and translate that into practice for the active industry? I don't have the answer, but that I think is the thing we need to think about together.
Yeah, I agree, and I think partly that's about a peak body for the sport industry in Queensland, working with government to broker that, like just the collision of sport and research together. I think there's a 1 + 1 = 3 that happens when you wind up having a conversation with someone who brings real subject matter expertise, but also an ability to translate that for sport to be able to go back to their desk and do something about it.
Yeah.
But if you don't generate the conversation, nothing changes.
So what's your message to people in the audience made up of both, you know, academics and government policy? I mean, how do we work more closely together, leaving this room?
I was about to say, grab a couple of chairs, sit down and have a conversation, but what I would say is have a walking meeting, right, on the basis of the tone of the conversation we're having here, is actually, there's I think some of the, I think we want for curiosity as an industry. I think we believe that so much of what we are setting out to do is within our own, is discoverable within what we already know. Yeah. And actually I've got a live example now of a collaboration with a university and its expertise to catalyse a whole new way of thinking, a whole new paradigm for thinking about innovation on a particular subject in sport. And that only came about because I stood next to somebody and said, hey, what do you reckon about blah, blah, blah? Right. And they said, well, I've got to introduce you to somebody, and away we went. Yeah. And so I think, again, it's a sample of one, but I think the more we put our questions out into the ether without any attachment to the kind of answer we have to get from the expert, the better off. We just need to do a bit more of that more often with more people.
Sian, did you want to add anything?
Yes, please. I am incredibly privileged to be in a position where my role is co-funded through the University of Queensland and Health and Wellbeing Queensland, and that came out of a conversation from Rob Littlewood and John Kearney, who wanted to do things differently and to establish a partnership that looked different between universities and government. And one of the things that I think has really accelerated the way we can work together is the fact that we can be responsive. Yes. So, things take so much time when you have a conversation, and it might be 3 years down the track that you might actually have some signed contracts. And so we are in a position where we can get a phone call, an email, and say, awesome, we can help with that. And that is a reciprocal relationship that goes both ways.
So I would like to go to your questions. I'm going to ask one last one so we can get... Oh, no, we've got one ready to go. Thank you, ma'am. If you could just raise your hand, and there's one down here in the 3rd and then one in the 7th seat as well. Let's get through as many as we can. Yes, ma'am.
Thanks, Madonna. Erin Waters here from Townsville, which is Walgorooka and Bindal country. First thing, please don't forget us in North Queensland in the lead up to the Olympics and the rest of Queensland. We really want to be a part of that journey. It's very exciting. Secondly, up in Townsville, I'm the director of the Medical Service for Aboriginal and Torres Strait Islander people, TARS. We're celebrating our 50th anniversary this year, and what we've learnt, the biggest health equity gaps, or barriers, sorry, are cost and transport. And I'd love to be able to recommend playing sport to our young people, but the cost of sport is, really high, as all the parents here will know. To play soccer, it's $800 a year, and for my daughter to do dancing, it's like $4,000 a year.
Wow.
Is there anything that we can do? Because I would just love to be able to say, go and join the local soccer club to the kids at our health service.
Okay, can I ask you, Tim, to take that answer?
Yeah, welcome. Thank you for being down in Brisbane. I think the answer to this one is about agency and empowerment for local ownership and delivery is what I would say here. I mean, I think we've got a state sporting organisation cohort who are members of Q Sport, and part of the conversation with that group at the moment is about saying, rather than the traditional model as we've done for forever and ever, which is to fly and deliver a program for somewhere between a day or 5 days, thank you very much, see you next year, is what would it look like if we built capability and capacity at local level so the community is able to own what is delivered with and for that community. Now, this sounds really easy when I say it out loud, but we've got a business model in sport that's built around we own the expertise, we own the product. We'll turn up, we'll arrange how that's delivered. It's competition-centric, it's time-bound, it's in this facility. And I think this is where, to the topic of this panel, there's a new norm needed, particularly where we've got an equity challenge, particularly where we've got a geographic challenge, so that we stop having a really a view that the best way for sport to be delivered is by the people in a capital city or the people in a position of influence or power.
Thank you, and thank you for what you do too. We've got some questions down the front here on this side of the room. If I could get a microphone, we'll go to one here, and then we've got 3 questions over here. Thank you. Have you got a microphone? Yeah.
It is working. Hello.
What's your question?
Thank you. I'm just interested in, we've been talking a lot about the Olympics today. The research on the Olympics so far is that no Olympics Games has been effective in increasing the physical activity participation of the people that live in the host city. So I'm just really interested to understand the people on the panel, just to see what would be your one recommendation of how we can do things differently here in Queensland going forward over the next 8 years.
Great question. I'm going to quickly go down, 30 seconds each.
30
Tim.
seconds. Stop waiting for the Olympic Games or the Paralympic Games to drive a legacy. Right, the Olympic or Paralympic Games is 4 weeks of icing on the cake. The work starts now. We've got 400 Mondays to the opening ceremony of the Olympic Games. That legacy starts yesterday.
Leverage what is already being done exceptionally well and amplify that.
I have nothing further to contribute. It's those things.
Tiana, you're our star, I reckon. Your answers. Yes.
I think learn from previous Olympic Games. So Paris have done a good job with some aspects, particularly what they've done in schools and they've done in workplaces. And remember that the purpose of the Olympic Games is multifold. It's not about promoting health or physical activity, but it does provide a unique opportunity where we can deliver the messages that we want to, where we can promote those messages through the event.
Thank you. In the 3rd row here.
Hi everyone, my name is Z. I'm a dietitian and a health consumer advocate. More of a comment and sort of aspiration to what we've been talking about today. I was lucky enough to do an internship with Health and Wellbeing Queensland last year. And interestingly enough, Health and Wellbeing lead by example with their policies and strategies. And one of the things that they do is provide an hour of power at work, which you are able to go and do a Pilates class or walk or meet and do what you want. And for me as a student or working 9 to 5 as a parent, I knew that 2 days a week I was at work, I would actually exercise. Yeah. Now imagine if this was incentivized to change our workplaces, knowing that it changes our mental health, increases productivity, but then, as Tim, like you said, brings the opportunity of sport and recreation to work and creates that time for you to go and do that and create that habit. And so as an adult, you're learning new sports and being encouraged to do them, but then also encouraged to start doing them at home because they become a norm for you.
Thank you.
yeah.
Yeah, a really good point. Just behind you, I think, could you put your hand up? Yes, in that. Yes, ma'am.
My name is Mackenzie Forrester, and I'm from an organization called Screen Sanity. I actually have 5 questions, but I'm going to pick one, off the top of my head. So, as an American, I've always noticed without having university sport as a goal for, all children, I really find that sad because it's just always there in your mind as something that you could do. People are striving to get a scholarship. People are encouraged to play through high school, and even in those early years, you're playing it because you have this vision of playing it at university. So I've always wondered how that could be more promoted for just the adolescents, like what comes next after school, and especially with the mental health of especially teenage girls, I think it's highly relevant and just an interesting conversation because that goal, I was never going to play university volleyball, but I thought I was, and just having that idea, then I wasn't alone in that. That is a huge cohort. So I'm curious the thoughts on that.
Yeah, because there's an increasing attention to year 13 in other areas of the life, isn't there? Anthony?
Yeah, you're right. As was said before, the transition from school to post-schooling is very important where we do see a drop-off. I do think there are things being done. I think there's a lot more sporting opportunities for females now to participate in sport, in sports that didn't exist 5 or 10 years ago. And the focus of those sports is on participation. So I know particularly in my region where they can go and play AFL, they can play rugby league, they can play soccer. There's a whole range of, and I think that's actually addressing for many of them when they get to university and want to still participate in activity, there's that. I think subsidising opportunities for students to be able to participate in fitness type based activities or gym based activities is important as well, and many universities do that. And many of our universities have amazing campuses where it's easy to be physically active. So again, they're starting to initiate activities that involve the campus and involve things like breaking up sitting times or studying times, using the campus for walking activities. So I do think there are things happening. Yep.
Thank you. Up the back, ma'am.
Hi, Vicky Gedge from Prevention Strategy Branch in the Department of Health. I just had a question for Anthony and Sian around measurement, because we use obviously population prevalence data and our Active Australia instrument's very blunt, so it really doesn't capture the nuances of how the guidelines are changing. Do you have any thoughts around how we can do that? Because obviously policy is informed by data like that.
Yeah, so there is a surveillance subcommittee with the new guidelines that are being developed, and we have representatives from each state and territory health department on that. So that's something that we are investigating, how we can do that and align it not only at a state level but align it with the new guidelines as well. So thank you for your point. Certainly something that is being considered at the moment.
Thank you, sir.
Thanks, Madonna. Dom Courtney from Outdoors Queensland. I just saw Tiani and Tim smile. I work with them a little bit as well. An answer up here was there's a wonderful organisation called Townsville Hike and Explore. They do free walks all over Townsville, bushwalks, etc. My question, however, is if we had our magic wand and we moved the dial from 40% of adults and about 2/3 of kids being sufficiently physically active to 100% in both cohorts, what do we do in relation to the infrastructure? How do we take the natural places where people want to get out and go mountain biking or bushwalking? What are we doing to make sure that the health dividend that those places are actually providing to our communities is actually being recognised and funded so that those spaces can actually continue to deliver those outcomes?
Great question. Who would like to take that?
Dom and I are in the office next to each other, right? So I'm just thinking you could have put this one to me before I got up on stage. I think the only thing I'd add to what Dom's asked there is that we have a critical shortage now of people, places and programs to be able to move from where we are to something approximating 100%. So investment now in those three things would be fundamentally a fundamental enabler of that kind of future.
The only thing I'd probably add to that is the importance of local government planning, because that's obviously where the rubber hits the road. And you know, if you walk across the brand new bridge and you look at how beautiful South Bank is, how do we make sure, and Townsville has a beautiful strand also, how do we make sure that there are great places for people to be active?
Okay, we have time for two short questions, one here and one up there. Yes, sir.
Hi, Tim Gill from the Obesity Collective. I just want to follow up from a previous comment about workplaces, because for most of our existence, occupational physical activity has been the biggest contributor to our physical activity. And over the last couple of decades, of course, that's sort of been lost. But it still is the biggest chunk of our day. So, you know, what can be done to make our workplaces, you know, more active? What can we do to get a bit of activity back into workplaces, particularly for those that are not working in, you know, government organisations that can give you an hour off for yoga?
You. Yeah, Sian, can I ask you to try that one?
Sure, I can, but on behalf of my colleagues, Professor Genevieve Healy has a fantastic program called Be Upstanding, which is a program that is now being scaled across the country and a range of different workplaces. And I think one of the most impressive parts of that program is the suite of different tools that the workplaces can choose from, and to be able to effectively co-design their own implementation strategies for those that can't do those things you mentioned.
Okay, thank you. And our final question up the back.
Oh, yeah, is it on? I'm Ellen Panaridos from the Alcohol and Drug Foundation. We have several programs that we work with in community-based, community development programs, and one of them is heavily involved in community sport clubs. And a lot of it, of course, is structured sport, formalised. So we have state sporting organisations, etc. But in the far north, I'm in Townsville based, again. In the far north, there isn't a lot of structure, but there's a lot of want to play sport. Is there any innovative ideas of how we can support sport in the far north more?
Okay, it's a theme. Tiani?
Well, I mean, I think I know that the North Queensland Sports Foundation is a primary organisation that also advocates on behalf of the North Queensland. They have partnerships with all of the local, well, not all, but most of the local councils in the far North Queensland, and I guess they provide quite a few initiatives through their platforms. One that I know of is a mobile physical activity app, which also has some nutrition requirements. Move it, NQ. Thank you, Robin. It was something that Health and Wellbeing Queensland and the department co-funded through our Active Kit program.
Anyone else want to add something there? No? Oh, Tim, no. I'm going to draw it to a close. Ladies and gentlemen, could you please put your hands together for Anthony, Sian, Tim and Tiani?